Health benefits of ginger. Antioxidants. Antioxidants are compounds that protect the cells of the body from damage caused by free radicals. These are very reactive molecules which are said to be involved in the development of cardiovascular diseases, certain cancers and other diseases linked to aging. 40 antioxidant compounds have been discovered in ginger. Some of them are said to be heat-resistant and may even be released during cooking, which may explain the increased antioxidant activity of cooked ginger. Ground ginger ranks third in antioxidant content among more than 1,000 foods analyzed. Note however that this comparison was made on the basis of 100 grams of food and not per usual portion, which corresponds to about 2 grams in the case of ginger. Fresh ginger also has a strong antioxidant activity compared to other vegetables and spices consumed in Asia. After about 30 analyzers, ginger, along with turmeric, mint, coriander, broccoli and Brussels sprouts, ranked among the 14 most highly antioxidant fresh plants. Ginger, garlic and onion. Consuming ginger with garlic or onion, or better yet, both, would create a synergy between their different antioxidant compounds. This would allow them to surpass their individual antioxidant effects. The main active compounds responsible for the pungent taste of fresh ginger are gingerol and gingerol. Their anti-inflammatory and antioxidant properties are well known and their anti-cancer potential is demonstrated in vitro. A recent study has shown a promising effect of ginger as a therapeutic agent in the treatment of prostate cancer. During the dehydration of ginger, gingerols are converted into compounds called shojales. This group of compounds is therefore found in greater quantity in dried or powdered ginger than in fresh ginger. 9. Study shows that shojales may protect cells from a compound involved in the development of Alzheimer's disease. The effects of the various antioxidant compounds isolated from ginger have been observed in vitro as well as in animals. These are promising results that have yet to be demonstrated in humans. Nausea and vomiting. Several studies have evaluated the antiemetic effect, the ability to prevent or stop nausea and vomiting, attributed to ginger. First, 2 studies show that consuming 0.5 grams to 1.5 grams of powdered ginger in capsule form may be effective in treating nausea and vomiting during pregnancy. In addition, a recent meta-analysis shows that 1 gram of powdered ginger in capsule form would be more effective than a placebo in preventing nausea and vomiting after surgery. For comparison, 1 gram to 2 grams of powdered ginger is equivalent to about 10 grams of fresh ginger. Finally, the consumption of ginger could prevent nausea and vomiting related to motion sickness, but the evidence is still insufficient to conclude that it is convincing. In this regard, 2 studies have not seen an antiemetic effect following the consumption of fresh ginger. The gingerols and shojales contained in ginger are said to play a role in the antiemetic effect, acting inter alia on the reduction of stomach movements. To date, the majority of randomized studies have been performed with ginger powder capsules and comparing it to a placebo. It is therefore difficult to determine whether the consumption of fresh, crystallized or herbal tea, for example, could provide the same effects. Digestion. A review article, in which animal studies have been listed, shows that ginger, like other spices, could stimulate bile secretion and the activity of different digestive enzymes, resulting in faster digestion. Food 21. The amounts of ginger used in these studies are high and even higher than could be consumed by populations known to be heavy consumers of spices, such as India. Although the consumption of such quantities is realistic for these populations, it is more difficult in a North American context where spices, including ginger, have less place in traditional dishes. As the effect of fresh ginger consumption on the digestion process has not been the subject of a well-controlled clinical study in humans, more research may eventually lead to more specific conclusions on the subject. Click on the description links for more remedies.